There's an old saying, it's not what you know, it's who you know. It's all about your network. Well, I'm not sure if that's true in life. It is definitely true if you're responsible for choosing your employee's health plan. In this episode of Healthcare Hacks, I'm going to talk about considerations you need to keep in mind when you're making that choice. Hi, my name is John. I'm your healthcare hacker and a network fit expert. I just made that last one up, but I think you get the point. Before we get started, please take a minute. I urge you to like this video, subscribe to all of our channels on your favorite social media platform. Athos Health is on them all. That way you can feed the algorithm. You can get our message out. We're really trying to help as many people as possible navigate our complex U.S. healthcare system. And by liking this video, you're doing your part. Today I want to talk about network choice. Now, it's a complex topic. There's a lot of variables that go into it, and there's no easy answer. And there's really no right or wrong answer. It really depends. But there are some things to keep in mind that are important if you're responsible for making that choice of what insurance plan your employees are on. The biggest issue I hear is if an employer is trying to switch plans to a different network. The employer is very concerned about the noise and complaints from employees that they're going to receive about that switch, right? The person's gone to a doctor for a long time. They don't want to switch. They're not comfortable, and HR is worried they're going to hear about it. I understand that concern. However, what I will tell you from my experience, it's not as daunting and it's not going to be as big as you think it is. Most people don't care. Yes, there are some that do, but many don't. As long as it's relatively in the same geography, they don't have to drive too much further. They really don't care. And those that do care, as long as you do a good job explaining why. The plan's cheaper, we can lower your premium, we can lower your out-of-pocket because it's a different network cost. Those are things, if you can do that, yes, you might hear a little bit when you initially switch, but generally it goes away very, very quickly. The second issue is to make sure it's broad enough, right? Again, especially if you've got a lot of employees in rural areas or areas that are dominated by one health system. You've got to make sure that they have options, that they can go to the health system and be a network. Now, one of two things will happen. Either your employees will be very dissatisfied because they can't, or they'll get network gap exceptions where they'll get that local hospital approved, and it's going to end up costing you and the plan more monies and raise your premium. So just make sure the network's broad enough that there's a cadre of providers in that area that for the majority of employees that they can see. Probably the most important thing about networks when choosing a health plan is that there is one. I did a video about a month ago about reference-based pricing plans. These are plans that don't have a network. And we can argue about the merits of it, the price structure of healthcare, but the bottom line is your employees will not be happy with these types of plans because it's going to cause more work for them. They're going to get balance bill and have to submit claims. And also they have no protection. If they get a claim denied, they're going to be fully responsible for paying the total balance. Whereas if you have a plan with a network, oftentimes it's a doctor's responsibility to fix the claim if there's an issue. So I would stay away from plans that actually don't have networks because they may seem cheaper, but in the end you're going to end up paying a lot more through employee dissatisfaction. The last area where network matters is around pharmacy, right? We don't really think of pharmacy and networks, but just like a doctor, a pharmacy can be in or out of network. And what we've seen is because there's some consolidation on the insurance side, more and more pharmacies are, being out of network for certain plans. So if you're going to switch plans, make sure that the pharmacies that your employees use today are still in network, especially in areas and geographies where there's not a lot of options. If the Walgreens is the only pharmacy in town and it's not a network, that's going to be a problem and you're going to hear about it. One way to offset that issue is make sure your plan has a mail order pharmacy option. Now, most plans do, but some don't. So make sure yours does, because not only will it help with the network, but they're more convenient and often cheaper than going to a brick and mortar pharmacy. Something a lot of your employees will like, especially as they get used to it, and it's going to drive down their costs, which is a great win. Well, networks aren't maybe the most important thing when choosing a health plan. They can be a big driver of your employee satisfaction. So try to give you some considerations to think about, but if you have any questions about this topic or anything else around the financial side of healthcare, please leave in the comments below. We're happy to answer your questions in a future healthcare hacks or just through direct message. And as always, make sure you get the facts, by joining me in the next episode of Healthcare Hacks.